I am the nurse. Really being proud of that is so important. There's so many digital health startups that would hire nurses in different roles.
Can we start with what motivated you to start Peer Team with a mission to simplify care for everyone from being a critical care nurse?
I worked in community health nursing with underserved populations. I worked in the emergency room that includes underserved populations. And I also worked in critical care in Boston, New York, and San Francisco. So I've always really thought about what leads to inequities in healthcare. Almost a decade ago, my hospital cut community health nursing. I knew the value of resources like that. I wanted to work for a place that really aligned with my values of equal access to healthcare. So I quit bedside nursing. I thought that I was going to leave nursing altogether and leave healthcare. And then I accidentally sort of fell into the world of startups. Someone reached out to me and asked me to help them draw blood for this pilot they were doing. And it quickly turned into a role helping to build out a national network of primary care practices that were very concierge, very tech enabled. And it was really fun. But again, coming back to my healthcare values, I wanted to be a part of something that created better access to healthcare for people who didn't have it yet. And so after getting more experience at another company building out tech-enabled centralized care teams and like what model really helps people drive their outcomes, I decided to start Peer Team with my former coworker at one of those startups who was an engineer. And really what we do is support clinics in their care delivery in underserved communities by helping provide additional staff that are remote to really care for their highest risk, highest needs individuals.
What do you think is the biggest barrier to get adequate medical care for patients in the US?
US healthcare system is incredibly complex. It's really hard to know how to navigate a referral or why you're getting charged for labs that your doctor ordered for you. People who come from underserved communities, low-income communities, there's extra barriers. When you're working 3 jobs trying to put food on the table for your kids, it's hard to make time to figure out the system. Having someone in your corner really makes a difference. And I think for me as a nurse, we are tried and true patient advocates. And I think that's a big role that we play in communities that have a harder time advocating for themselves.
Could you tell us more about what Peer Team is closing that gap?
Peer Team's care model includes community health workers. So these are folks that have, a good level of healthcare education. They can help with care coordination and healthcare navigation. They go to appointments with patients. We have community health workers who work virtually to really be that patient's main advocate of the healthcare system, not just clinical things, but also social things like trying to get housing or job training. That's where our lead care managers really play a role. And they're trained as community health workers. It's just they do everything over the phone or text message. We have behavioral health to support people who have mental health needs. We all know how much, battling a mental health condition can impact your physical health and just overall quality of life. These practitioners are really hard to access, even if you have great insurance. Being able to provide that experience to people, it's even harder for them to get mental health support, and do it virtually, which makes it easier to access, is really important. We have nurses on our team who play a role in triaging patients when they reach out to us for help and helping them decide and understand where to receive care. We have nurses helping people juggle the many different referrals and tests, navigating discharges from hospitals. And they also do post-discharge follow-ups. And we know the impact of doing as soon as possible discharge follow-up with patients to educate them, ensure that there's no med issues, things like that. Our nurses play a big role in helping to reduce unnecessary hospital visits and readmissions. And then last, we have nurse practitioners. I really believe in the nurse practitioner model. They really come from a background of that we have of hearing patients, assessing, developing care plans, and really bringing the patient into the advocacy of improved health outcomes. And so they play a role in providing primary care services. If I prescribe insulin, do you have a refrigerator, or do I have to find something else that'll help manage your diabetes?
It's simple to say, but there are a lot of parts to move. And I bet that it's like a complex system to create. What do you think AI and technology, what kind of role do they play in nursing?
I think it depends on what setting you're in for nursing. Like I remember when I was at the bedside and, the manager would come and be like, hey, there's this new system that we're going to use for X, Y, and Z. And I'd be like, oh my God, like another one. But for us at Peer Team, we use artificial intelligence and machine learning to really support people in doing the work of building and maintaining relationships with people. If you think about our work as nurses, the reason why we're so loved is because we can really foster trust. We're the ones that spend the most time with patients. We take the time to educate them, hear them, and all that's really doing is building trust. For us, we think about technology and our products as what information should we flag to you to help you contextualize the care that you're providing. I know it seems very little, but when you're calling to follow up on a discharge, having that information and not having to rely on the patient to tell you really helps them know that you're very involved in their care. Automation really helps get rid of the back and forth of getting a medical record request signed and then faxing it. All that time that someone would have spent dealing with paperwork can then be spent on the phone or texting with someone to really help them. And I think that makes a really big difference when you think about the scale of support that people need.
Helping nurses and nurse practitioners time manage so they can spend that time with patients, whether it's at bedside or in communities. That's great. You went to nursing school in Boston, started your nursing career in New York City, and you started your startup and tech career in the San Francisco Bay Area. Could you share with us what San Francisco means to a healthcare startup?
San Francisco and Silicon Valley is the heart of innovation and technology development. It's where Google and Apple come out of. And so there's just a community and environment of accepting innovation and thinking forward and making investments in the possibility of better. I wasn't pulled into that world until I was in San Francisco and really seeing the value of all these different people working on different things. And it built this confidence that I could play a role in that as well. I also quit my job in New York because I was frustrated with the system that I was a part of. I came to San Francisco because my husband was born and raised here, but I did not apply for jobs at the hospital systems here. I took travel contracts to figure out what was the hospital like? What are the different units like? Do I like the manager? Do I like the team? Do I like the philosophy behind the healthcare system rather than just signing up for pension?
What do you want to tell nurses who think they're stuck in their job right now?
This is why I'm excited to be here with you. Nurses have so much potential to do anything that they want. And I truly believe that after sort of seeing the squiggly line of my career as a nurse. The skill sets that we learn in order to be good nurses are so transferable. Assessments and care planning and building good relationships with patients and their family members and educating, right? Those are such transferable skills. If you were to become a product manager, right? They're basically doing the same thing to build a product, but instead of assessing a patient, they're assessing key stakeholders, right? Same thing with being an entrepreneur, right? The assessing I was doing was what problem do I want to solve? The care plan is the product I wanted to implement in the world. The key stakeholders are not just my customers, but also my team that I'm building. If you start to think outside the box of what does it truly mean to assess a patient or to build a care plan, you can see those parallels in other career tracks. Remembering how scared you were the first time you had to go on the floor and talk to or touch a patient. I remember I was so scared to take my first blood pressure. So now it's I could do that in my sleep. Pushing yourself to be I want to try something new. I I know I can learn this, you'll see so many possibilities. It's really important with the healthcare crisis in America of so many nurses leaving the bedside. Over 70% of our nursing workforce is over the age of 50 and will be due to retire. We graduate tons of new grad nurses, but most of them leave the bedside and workforce within 2 years. I mean, I was one of them, right? And so why go through all that education and like follow your dreams of being a part of healthcare and helping people just to leave healthcare altogether and not transfer those skill sets into something else that you may be passionate about. I feel very strongly about nurses just being willing to trust yourself, to do things that are uncomfortable, and really think about like, how do nursing skill sets transfer into other careers?
I felt like I was stuck in bedside nursing, but that is not true, as you said. And when we start as a nursing student, we often say we're just nursing students, we're just nurses. Our skills and experience and insight, they're transferable to any field that we go into. So I think that having that open mind and not locking yourself in for your own job is very important. Thank you for sharing that.
Yeah, you can switch units. I switched from, cardiac to neuro. It just requires you to just like really study, know why you want to switch, and like put your head to the grindstone and be willing to be uncomfortable and have to like learn things all over again. I've seen, nurses go from like bedside to ICU. That's a big leap and it's scary, but like you just have to like be willing to know that you're not going to know everything right away. And you kind of got to fake it till you make it. And then before you know it, like, you know it.
What do you think changed the most from working in a patient-facing role as an RN to working as a chief operating officer at Pear Team right now?
I've always cared a lot about like impacting people's lives. When I was a bedside nurse, the people that I would impact were like the immediate ones around me, the patients that I had. When I became part of a startup, it was I could be a part of the process and playbooks and care delivery for patients that accessed that place. When I became leadership at the second startup, it was like I can build the team. And now it's like the impact that I have is like this idea that I'm trying to drive into reality, creating the team, the product, and that magnitude is much greater than what it was at the bedside. And I really miss direct patient care, but I have to accept that in order to like create the impact that I want, I can't do everything. I mean, nurses know this, right? Like you can't do everything. Like some things you have to delegate to like your nursing assistant. And so a really good skill set is learning how to delegate and manage people. That again is another skill set that I took from nursing.
For those nurses who want to go into the startup side, but they're scared to do so, what avenues do you think they can start dipping their toes in?
What's really great is that there's so many digital health startups that would hire nurses in different roles. Our nurses on our team joined our startup, doing triage and health education. That's like probably easier jump to do is stay in a clinical role, but in a different environment. All of our nurses work from home. Now they're working alongside the product team and engineers. But one of our care coordinators from a few years ago ended up going to product management school and is now our PM. But she came in as a care coordinator in a role that she felt more confident doing at the time, and then used the opportunity to be a part of a startup. For me at my first startup, like I went in to draw blood and then quickly started learning how to build a team and build playbook. I think you just have to find a role that is parallel enough.
You did a lot of initiation, even as a bedside nurse, from helping expanding a unit to creating a pre-operative checklist. Where do you think your drive for change come from?
Oh, I'm really stubborn. I don't like when things don't work the way that they should. All of those things came out of like a frustration that I have. I like put my energy into things that like drive me crazy and like are problems in my mind. I'm just like driven to solve those problems. The preoperative checklist came from, I worked in ventricular assist devices. And so we'd have patients get a call that they have a heart transplant that they need to come in for to receive. And patients would come in and then they'd sit around waiting for the resident to come by, see them, order the blood test, and they have to get their blood drawn and wait for the results to come back to like be able to go to surgery. Like there's a lot of things that have to get done pre-op. And the patient was just sitting there. And like, can you imagine how anxiety provoking, like you're excited, but really nervous. I was like, why not just implement this across the board, get approval from people, talk to stakeholders, and then push the checklist along for approval, which takes forever. But what it would result in is me as a nurse being able to deliver better care for my patients and really support them in a more holistic way than just like they're going to get a transplant.
I think there are a lot of nurses who want to make that change, but they don't know how to do it, especially in Asian culture. Like it's very hard for a nurse to initiate a change. But I think like seeing you just moving that and acting on it, and it's for the patient care, right? It'll inspire a lot of folks so thank you.
Yeah. When I did that project, I was like completely a new grad, still had my preceptor. I think there's different ways to navigate it. Like I just am like super forward. I just like push things through. I talk to whoever I need to talk to get things done. But I think there's early steps that you can take, developing a good relationship with your manager so that they can help you navigate the like political landscape of what's happening at your hospital. If you have like a committee on your unit, get involved in what they're currently working on so you can understand like how it works, who does what approvals do you need to work on things? Do you have a budget behind things? You kind of have to be willing to do a lot of the work if you really believe in it, but getting allies, getting exposure to how things work, and then not being afraid to just like bend the rules or the status quo a little bit is really important.
What do you think is this atmosphere looking at healthcare startups in Bay Area right now?
The economy is going through a lot right now. There's inflation, like a lot of big tech companies laying a lot of people off, but always have healthcare needs. Like healthcare is such a big problem in the United States in terms of our spend and experience. Healthcare will always be something that there's opportunity to build in. What I will say is healthcare is so complicated that not everybody gets what you're building. And I think that comes into play when you start talking about fundraising and venture capital and how to fund your company. You really have to look for partners and like venture capital firms that have experience in healthcare so that they really get what you're building, the why, and the market opportunity.
What was the most challenging when building and running a startup?
I actually think the hardest thing for me was shift my mindset from where it was at of like, this solution just has to exist in the world. It should be free for everyone. Everyone deserves access to healthcare, to an entrepreneurial mindset and like building a business to say, like, if we don't have a sustainable revenue model, all the things I care about of like impacting communities cannot exist. Trying to figure out how to align my values with a business model. Before, when I worked for someone else, it was someone else's job. And now it's my responsibility to make sure that the people who are doing their jobs have an opportunity to like increase their impact because we're growing as a business.
What helped you to transition from that nursing employee mindset to a business mindset?
I truly believe in the potential of what we're doing and our mission to like bring better access to care to underserved communities. If I want to impact these communities, I have to earn the right to be able to pay the team delivering that care. I have to earn the right to expand to more customers by doing a good job. What that results in is the impact that I always wanted. The business model is more of like the how behind it, not the what of the product.
It sounds like you're very passionate about why you're doing this for the underserved population, and that's your drive to push it forward. What do you want to tell the nurses out there that they're worth?
Man, we are the most incredible profession at all. Like, we are so valuable. Your friends come to you for things, your family asks you questions. It's because they trust you. In the United States, nurses are always the top most trusted profession. And we know our stuff. We are very smart. We're very intuitive. We pick up on things that like doctors don't even see, right? Those are such amazing skill sets. Like, to your point, we say like, oh, I'm just a nurse, because people ask like, where's the doctor? Are you the doctor? It's like, no, I'm just a nurse. It really undermines our value and the critical role we play in all of the settings that we're in. I am the nurse. I am a nurse. And like really being proud of that is so important. Do some research. Nurses have led so much innovation around the world. It was a nurse that created the PPE so that we could address the Ebola virus. It was a nurse that discovered that sunlight would help treat jaundice for babies. Be really proud of the fact that you're a nurse. And I think you'll just step into all of its potential.
Even Florence Nightingale was an innovator, right? So we have that genes in us.
If you go to Johnson & Johnson Nursing, there's a lot of information about the history of nurses there.
Cassie, how can the audience learn about what you do online?
You can find me on LinkedIn, Cassie Choi. You can find our website, pairteam.com, PAIR team.com, or you can reach out to me via email, Cassie@pairteam.com. I'm always happy to chat with people thinking through navigating their nursing career.